Great. So as you heard, we're all a bit nervous because we're not used to this style of talking. But as I was thinking about what I was going to say to you all today, I was thinking about the theme of the conference and thinking about impact, how research would have impact and change things. Because actually, I'm sure everybody in this room is actually here because they want to have impact. And I thought about the projects and things that I'd been involved in that had impact. And I think there were 4 themes that kept coming up. One was that you were really in touch with the public and the patients, not just listening, but having a relationship, and we heard about that at the panel this morning. That you had a really skilled team with all the skills needed to deliver. That you had communication channels with policy, with practitioner, with voluntary organisations, so that there was an understanding of what was needed, but also you could push results out. But finally, I think it's passion. I think we heard that it's challenging to make change, it's challenging to have impact, and it's really, you need a bit of passion to get you over those hurdles and to the finish line. So what would I have said to myself 10 years ago? Well, I thought, 10 years ago, I was in Welsh Government. I was the Chief Optometric Advisor on the other side of the fence, and giving advice to ministers on eye care. Eye care is the busiest specialty in the NHS. We have more operations and more outpatient appointments than almost any other specialty. And at that time, we could already see that our waiting lists were going up. And we were hearing that that was impacting on patients, not just inconvenience, but people were losing sight permanently because they weren't getting treatment in a timely manner. And also then, the people who had a visual impairment, they weren't getting the services and support they needed at a time they needed it. As an advisor, you're not just there to tell ministers about the problems, you're there to give the solutions or advise on some of the potential solutions. So I was going out to researchers, to practitioners, to health boards saying, so how are we going to fix this? What ideas have you got? And there were lots of great ideas. Moving some patients into community. We could do virtual reviews of images without having to bring patients into hospitals. We could get people other than doctors to provide some of the care. And so I said, great, that's fantastic. So can you just give me the evidence? How will that change waiting lists? How much is it going to cost? Do patients think that's okay? Are they happy with those changes you're proposing? And is the capacity and workforce there to be able to deliver this? And I got a few scanty audits, a bit of business information from health boards, but there was almost no evidence that could help inform decisions that were being made. There was loads of evidence about the drugs, how they worked, lots of evidence about the surgery, what we should do when, diagnostic techniques. We knew so much. We knew a lot about the epidemiology, the disease courses, but we were putting those into this ecosystem of service delivery that wasn't functioning. And so we weren't getting the outcomes we needed. And so I could see this huge evidence gap. And I started going out to academics I knew in my own institution in Cardiff University and said, this is an area you really need to start researching in. It's going to have real impact, be really important, and that this problem is only going to get worse. Nobody was interested. Nobody picked it up. Went to other institutions, went to professional bodies to try and get them to fund this type of research, because I could see in the future it was going to be absolutely key to have it. But nobody picked it up. So we made decisions, and I'm pleased to say that lots of them were impactful and have started to make change. And I moved out of Welsh Government at the end of my secondment back into Cardiff University. But I hadn't stopped looking for this evidence, looking for the people that were going to provide it. I was chair of a committee that advised government on eye care issues. And so as part of that committee, we set up a research day. Healthcare Research Wales helped us to fund that. And we also got the College of Optometry and other professional bodies to come in and help. We had a fantastic day. People came from all over the UK online, and some really great discussions. A strategy was written, and I thought, this is it. It's going to happen. People are going to start doing this. Nothing happened. In the background, before I went into government, my research had all been focused on low vision rehabilitation. That was my specialist area of practice. I had a good international reputation in that field. But when I came out, my heart wasn't in that anymore. I could see that I needed to start working in this area, that I'd seen the gap in government. And so I started to do projects, work with people, started coming together with different professionals, GPs, pharmacists, ophthalmologists, nurses, social workers, rehabilitation workers. Started to work with different people from different methodologies, health economists, people who were good at public and patient engagement, GIS mappers, realist reviewers, mathematicians that could model. And so different projects progressed. I got my first grant, which was Healthcare Research Wales, patient research for patient RFPB, you know it. Anyway, I started that project, which was working with a mixed team of different methodologies, different professionals. And it was a really great project. It was about moving services from hospitals into the community for people with glaucoma and medical retina. And we find that by doing that, you could dramatically reduce the waiting lists from years to just weeks. It cost the same amount of money, and that patients really liked it because they didn't have to travel to hospitals, they could go locally. And actually the workforce were really pleased because the optometrists in the community, they were their patients as well, and they could see they were waiting, and they could see that people were losing sight, and they wanted to be part of that solution. And it was a great time because policy was being changed in government, and we were able to present to them, and the new contract for optometrists in Wales now includes monitoring and management of people with glaucoma and medical retina all across Wales in optometry practices. But as we talked about earlier, the panel we're talking about, the grant finished. And all the grants that everybody was doing in our team that we were building just kept finishing. We would lose momentum. I'd have to go back. I was director of learning and teaching at the time in the school. And I had to go back to that and was drawn away. And then we had to start again. And then someone came along with a catalytic bid. They said, this is what we need. We know we can make real impact with our research, but we need a sustained funding. And so we started to work together on the bid, and it came to the bit about who's going to lead the centre. And everybody said, well, that's Barbara. And I just said, absolutely not. That is not me. I don't have an international reputation and the prestige needed for this. I really don't think I've got the credibility to lead it. But the team were absolutely adamant that I had to be the person to lead it because they said, you know about impact, you've got really good channels of communication with lots of different stakeholders, you know about the different communities that we need to spread into to understand what the needs are. And, you know, some of us have got that prestige internationally. You've got a bigger track record than you in terms of grants. We think you're the right person to lead it. So I eventually gave in, and we wrote the bit about me in it, and it went out for peer review, dreaded peer review. And lots of the peer review came back very positive, but I think understandably, some of the peer reviews came back and said, is that the right person to lead this centre? And I still questioned that. In fact, we had a whole meeting again of the team about, should I be the leader of this bid? Should I be the director of this centre? And they stuck behind me and said, absolutely you should. We just haven't articulated it properly. And I also went to leaders in the university, esteemed colleagues, and said, what do you think? And they said, yeah, no, we think you should lead it too, but we get what they're saying, we get your nerves, let's get you some mentors around this so that the things that people are feeling you don't have, you've got support to develop. And so we went forward, and the bid was successful. And it's just such an exciting development. We're now going out to try and change eye care services, the thing that when I was in government we were seeing that things were going wrong. And I'm really pleased that, what would I tell myself 10 years ago? Actually, I thought there's not much I would say, because sometimes in life the journey is as important as the end. And I think in this stage I learned a huge amount about research teams. And we've got a dedicated research team, great communication with public and patients, which now with the infrastructure we'll really be able to develop and embed. I think we've got a skilled team and, really excitingly, good communication channels. And so I leave you with a quote from Helen Keller, who was a lady with visual impairment and hearing loss, who was an activist for disabilities in the 1800s. And she said, "On our own we can achieve so little, but together we can achieve so much." Thank you.